Hey, let's talk about a case study where at least it starts off really weird slash funny, but then I think there's just some basic things that we can always go back to because, at least in my mind, this wasn't terribly complicated. But we talk almost ad nauseum about imaging and some of these silly social issues that I think are very, very foolish in terms of where people value things like MRI and surgery, because primarily my opinion is that this takes away control from the therapist and or chiropractor, whoever, and I think that's actually very, very correct. But that doesn't mean these things are bad. It doesn't mean these things should be avoided. We talk about a lot of good situations because of relationships and dynamics. They work, and we always look for what the person says, what the person does, and the truth. Well, sometimes you go to a new situation where now I'm licensed in California, and the relationships that are pre-existing are not the ones that I have strong connections to in terms of surgeons, physicians, etc. So in setting up my schedule, I would typically ask new patients to send me everything you have. I want to see, there might be no value or relevance, but certainly the MRI radiology report is a good place to start to see what is the truth. And we know that might have absolutely nothing to do with anything, but when there is not control, even before any one individual is involved, it can get, in this case, luckily silly rather than ugly. Lumbar MRI, this is lumbar pain. And what I can also add to this right off was this patient was describing their back pain had onset from a bench pressing episode where they were being coached to arch really, really hard. And that's been a big part of some of the most recent Instagram run, talking about the bench press, how the arch, how shoulder blades, how the shoulders all come together. All that stuff is going to culminate in T equals R the shoulder, at least at the time of as we're filming this. So extension-based back pain. Feeling better over time, ready to get back into training, not sure what to do, really where they're at now. When I looked at the radiology report, L1, 2, no problem. Actually started at 12-1, actual language normal, among others keywords. 1, 2, normal. 2, 3, normal. 3, 4, normal. 4, 5, hypertrophy of articular facets. 5-1 hypertrophy articular facets. So there was nothing really strange. And in fact, if we're going to look at somebody that maybe has a chronic extension strategy, they should have hypertrophy of the bed joints at 4-5 and 5-1 if that's where they're hinging. That in itself is not a problem. That in itself is not evil. That in itself I would not even consider pathological. I would consider it a fact. I'm not sure it would mean anything to anybody. And there was a point that this individual did not have back pain and probably still had hypertrophy of those particular segments. However, they did have pain, and it started with extension. So maybe this wasn't an ideal stabilization strategy for them, and this irritation has continued and has not been cleared. Now here's where it got real wonky. In what appeared to be scratch written, I would be real flip and say crayon, it was written under 4-5, torn disc. Yes, it said torn disc. Regardless of my communication to this patient, who really understood everything, I think they're just disappointed that their back just doesn't feel good, but they understood some of these explanations. Number one, torn disc can mean a lot of different things, and none of which are consistent with the MRI. If any of the things that maybe as clinicians we would expect a euphemism or some kind of other, some type of language that maybe the provider felt that they needed to dumb it down for somebody. We know torn disc can mean a number of different things. None of those were consistent with the MRI. That being said as well, we also know torn disc is not standardized language because it can mean a million different things. It can mean bulge, it can mean annular tear, it can mean herniation, it can mean extrusion, it can mean, by definition, something torn. We could say it's the vertebral end plate. We just named 5. I'm sure there's more if we really dug in. And that's very common with any type of back pain, where there can be a number of different pathologies. So the more important thing is that there's zero evidence. And now maybe I can see why this person hasn't cleared their pain, because then it probably tracks to confusion. It tracks to something potentially psychosocial. But just from looking at the MRI and knowing their initial mechanism, I'm like, all right, we're in for this, because it's literally scribbled. It's like written in pencil. It's written in by hand at 4-5, torn disc. When the language of 4-5 was hypertrophy of articular facets, and maybe something that said like otherwise normal. I'm like, oh my God, how is this even? I guess it would be possible, because certainly radiologists aren't God, but they are the most trained at reading images. And because they're just doing one thing and don't have to link it to any other type of context, they're usually of a higher percentage of being correct. Whereas if we're a clinician, we need to link a number of other things together, which may or may not be relevant, as well as what the person even wants to do and what are their standards for success. A radiologist doesn't have to deal with all that. An interventional radiologist, perhaps, but this is just somebody that's going to read images. So perhaps the physician that ordered the MRI believes that the radiologist is a complete doofus. That is very possible, where they're looking at this images, which there were a couple that were provided. Number one, looking at MRI images on email without the correct program or viewer is not proper. I mean, sometimes you're going to see major things. These were so grainy and so difficult to read that I said I can't even comment on this, because I think 5 out of the 7 images were not even good image. Like, these were slices that were not going to reveal anything in the lumbar spine, and the ones that did, it was very, very difficult to say anything because of the poor quality through the cell phone. That's also very, very important. Even in very, very high level situations, I have had the surgeons preface their report by saying MRI images reviewed through cell phone, even if it is on the correct portal that we'll see with a lot of professional athletes. The not medical technology, but the platforms that the leagues will use for their healthcare can be accessed on email. And these are good images. This is just not the industry standard. So you see, this is already like really, really challenging to see someone for the first time and have to communicate these things, because torn disc is neither standard nor accurate. It's not consistent. Now, maybe there was other episodes of evaluation and they just chose to write it on this one. A number of different things. I think we have to be able to say that there was nothing consistent in the language of the radiologist at the time of when the radiologist reviewed those images with anything that could be construed as a torn disc. I mean, so when people want to get fussy about MRIs being this and that, this is one of those situations, because whatever the physician that said torn disc, either they're a complete doofus or the radiologist is a complete doofus. I'm taking the radiologist's side in this, given what the patient said and then what the patient did. Okay, we always try to link those three together. The name of the pathology is irrelevant anyway. There was no evidence of any pathology on neurological exam. Myotomes, deep tendon reflexes, everything was solid. Okay, so regardless of whatever it is at 4.5 and 5.1 or any area of the spine, there's nothing that says there's any nerve root or south issues. There's no compression, there's nothing doing anything. This is just back pain, and the MRI actually is consistent with somebody that arches hard. Okay, touch your toes, just fine. Rotate, just fine. Buries a squat, shoulders, nothing. The only thing that was limited was multi-segmental extension. Very difficult to see that if it might have been coming from the thoracic at the top tier, but I think you'll see individuals that have more hypertrophy in the more proximal thighs. These are people that bike a lot. These are people that are typically very strong, that have a unique shape. Then they're going to be limited in extension. They might also be retroverted. So they're going to be challenged to keep their feet together and bend backwards. But this was back pain for her, okay? So then we go, the linchpin in this was not necessarily a segmental curve with extension. Same, little bit better, but non-segmental in prone, but no pain. So we have to implicate the lower half not as a generator, but a mechanical companion, if you will, that leads to this overload in the lumbar spine. Because if you bend backwards prone, no pain. If you bend backwards standing and you have back pain, well, then the answer probably has to be south of the lumbar spine. Because when you're prone and you even put a little bit of flexion under the hips to minimize any extension pattern from the lower half, if you want to argue SI, you should be correct. Like, we should be evaluating the SI, especially since the MRI did implicate some type of anatomical change at 5.1 and 4.5, both of which has the lumbar pelvic ligament that attaches, which then, if it's attached to the pelvis, then the sacrum has to be, it just has to be. If things are all attached, something has to give. So that being said, our attack point was less where the lumbar spine would be feeling your pain, but looking above and below. And then, because I'm just seeing this person for the first time and their coaches are entirely competent to execute special exercises for movement plan, we just plugged in everything. And I should be able to kind of go through this list by rote, where if someone has this extension stabilization issue, well, first thing you have to ask, is it mobility or stability? And we're going to look at everything. And let's gain some mobility and then follow through stability. And we can kind of attack them both at the same time. And then we pick and choose which ones are the answers. Okay? So